Yeah, so let me just start my presentation here and provide some background for our research paper. So we know that education is strongly associated with better health outcomes, including lower mortality rates, but more emerging studies actually suggest that there may be potential upward spillover effects from children's education for their parents as well. And this study from like various countries and regions suggests that parents with more educated children actually experience better cognitive outcomes, lower mortality rates, and also improved physical functioning and mental health outcomes. However, it's definitely challenging to establish causality between children's education and parental health outcomes because there can be multiple confounding bias here. So, for example, parents' early life socioeconomic conditions can definitely can be correlated with their own health outcomes in their later life. Also, they can be correlated with their children's education as well. And there can be also reverse causality issues because poor parental health can also limit children's education opportunities as well. So studies to address these issues, studies typically have leveraged education reforms such as compulsory schooling laws that increase access to individuals' access to education in a more quasi-experimental framework. And these particular studies from Tanzania, Sweden, and China, they have shown that children's education is actually linked to increased parental survival, but the effects actually may vary by parent and child gender. But one limitation from this study is that while their internal validity is very high, they do focus on lower levels of education, such as primary and secondary education, which ranges from like 6 to 9 years of schooling. And their findings may not easily generalizable to settings where more higher education, such as college education, actually matters for in policy discussion. So we think that South Korea, in that regard, provides an interesting case study because in 1993, the Korean government implemented this higher education reform that basically deregulated a lot of higher education institutions. And as part of that, they removed admission quotas. So basically a cap for the number of students that institutions can receive per year and per institution. They removed these admission quotas, and that led to a 45 percentage point increase in college enrollment rate over a decade. And this has served as a natural experiment to study various outcomes such as fertility and also labor market participation and earnings outcomes. But it hasn't been actually used to study health outcomes so far. And also the fact that older generations in South Korea, they typically rely on intergenerational support from their children a lot because of limited public safety net and like pensions and also strong filial obligations makes it more possible. We think that the spillover effects in the case may be a little bit more significant in this particular setting. So in this current study, we aim to estimate the impact of adult-child college completion on parental mortality by leveraging this reform as a natural experiment. And we also examine potential differences by parent and child gender, as well as parental socioeconomic characteristics. And we think that there can be two key mediating pathways. The first is the economic pathway. For example, highly educated children are probably more likely to achieve financial stability, which makes it easier for them to support their children financially and ease financial strain, potentially also improving healthcare access too. There can be also non-economic pathways, so these children can share knowledge about health, promote healthier behaviors, and they can also lead to improved parental health outcomes. So for this, we use Korean longitudinal study of aging, which launched in 2006, and with over 10,000 respondents at the baseline. And we include 6,068 respondents who were at least 51 years old at the baseline, who had at least one adult child from the reform-affected birth cohort or preceding 10-year birth cohort. And this, we have over 3,000 women and over 2,000 men in our analytic sample. And we use this exposure to the reform as an interim variable. And this is a binary variable where we assign the value of 1 if the kid, the respondent, the child, was born between 1974 and 1983, because 1974 was the first birth cohort that was majorly affected by the reform. And we assign the value of 0 if the kid was born between 1964 and 1973. So that's the preceding 10-year birth cohort, which constitutes our control group. And in our sensitivity analysis to test potential cohort effect, we also adjust dispersed cohort boundaries from 3 to 5 to 10 to 15 years to construct this IV. And we do see pretty actually consistent reduction in mortality regardless of this specification, but in our main analysis, we use 10-year birth cohort because below that, we just don't have enough power to do subgroup analysis. And our main exposure variable here is the child college completion. Here we focus on the education of the oldest child, but in the sensitivity analysis, we also look at the education of the highest educated child as well as the proportion of children who completed college within the household to see like this potential cumulative effects of education too. And our dependent variable is the respondent's survival time that is measured in years. And we track them until death of the respondent or the end of the study period, so that's 2020, or if censoring happens. So that is that includes the cases where these respondents are institutionalized or they move to other countries or they drop out of survey for other reasons, which we address using inverse probability rating later. We also control for various covariates, parents' socio-demographic characteristics, household characteristics, as well as early life characteristics, including their parents' education level. We also control for mediators, so variables related to intergenerational support and relationship, also parental health behaviors like smoking, drinking, and exercise, and also various age-related chronic conditions. So for analysis, we use instrumental variable estimation with survival model. And we use specifically Cox proportional hazard model to deal with the survival time data. And we use two-stage residual inclusion approach to combine these two nonlinear models with the IV. And in the first stage, which is a logic model, we predict children's college completion using the reform as an IV to isolate the very exogenous variation in children's education. And in the second stage survival model, we estimate parental survival by including the residual from the first stage. Here are some descriptive statistics of our respondents in the treatment and the control group. As you can see, the respondents, so the parents in the treatment group are definitely younger because their children are younger, and they are more likely to be married and also more likely to be educated. They have less number of children who are also more educated. Here are our first stage results, which shows that the children who are affected by reforms in the treatment group, they definitely have much higher college completion rates compared to those in the control group. And that's especially the case for daughters. So after adjusting for various covariates in the first stage, we see about 18 percentage point increase in college completion rates for daughters, and then 8 percentage point increase for sons. And these are all statistically significant. Here are some observational evidence for our analysis. So on the left, we see this unadjusted survival curve for the treatment and the control group, and we see a pretty big difference in the survival rate by the end of the study period between these two groups. And after adjusting for covariates, the gap still persists, and the gap still persists here, even after adjusting for covariates. And now we turn to the quasi-experimental evidence. Here we are showing the hazard rate from the second stage. So it shows the relative reduction in mortality risk for those who have children who are college educated. And overall, we see about 16 percentage point reduction in parental mortality when their children are college educated. And here we stratify them by parent and child, sex or gender, as well as parental SES. And we see about 12 to 21 percentage point reduction in relative risk mortality overall. And as you can see from here, the confidence interval pretty much overlap across subgroup. We don't think that like the benefit was particularly just concentrated in one group, and the benefit was more broad and comprehensive in our sample. We also show the impact of education on parental health behaviors and also relationship and support, so our potential mediators here. And we see that parents actually smoke less and tend to exercise more when their children are more educated. And also they seem to have more frequent contact with their children and also receive financial support and gifts when their children are more educated. And we didn't see significant differences between daughters and sons' education in this regard. And after adjusting for these mediators in the main analysis, the effect of child education on parental mortality was slightly attenuated, about like 2 percentage points, but the results remained pretty strong. And we also conducted several robust tests to validate our findings. Due to time constraints, I'll just briefly highlight the key points here. The first thing is that our results remain consistent across different birth cohorts of the parents who actually experienced very different historical events, such as colonization, the war, and the industrialization, which can be correlated with like long-term health outcomes. And second, we also did placebo tests using data from other countries, including the United States. We basically used the HRS data to replicate this. And we found that the effect we see, the observed effect on mortality, is actually unique to South Korea. But we also like to expand to other countries for placebo tests that are more similar to South Korea in terms of baseline characteristics. Also, the impact of children's education seemed to be only on actual mortality, and we tested on other age-related health conditions, chronic health conditions such as hypertension, arthritis, stroke, or heart disease, and cancer, and etc. We actually don't see any significant impact on any of these age-related chronic conditions, which could suggest that the observed impact on mortality may not be simply just driven by age effects or like general health improvement in the Korean society. So to conclude, I would like to highlight some significance and also limitations of our study. First, to our knowledge, this is the first quasi-experimental study to measure how children's education, actually higher education, may impact parental health outcomes. And our results show that when children actually complete college, their parents also experience a significant reduction in mortality, even after accounting for potential mediators that we have. We didn't find consistent evidence of heterogeneity across subgroups. And also there are limitations of the study. The thing is, our estimates are local leverage treatment effect, meaning it applies to only those people who were actually affected by the reform in that particular period. It doesn't apply to all populations or different context, different policy context. Also, there can be other like concurrent macroeconomic or societal shift that occurred alongside the reform that could also influence our results. And some people also suggest that there may be potential disparities in education quality for the, due to the rapid expansion of the higher education, and that may also change the return to education. But also some other people say that the quality hasn't actually changed that much in terms of education quality metrics, but we are not able to account for those factors in our own analysis due to data limitations. But I think despite, and I think that can also guide us to a future research to explore more of these regards, and also how to apply our research in more broader context. So I think that's it for my presentation. Thank you for listening, and I look forward to our discussion.